Hello everyone. We're in consult corner here talking about colonoscopies, and in particular we're going to talk about what is a bowel prep. Now the bowel prep is the reason why none of you jokers want to have this procedure, because it sounds so horrible. I'm not going to be able to eat for a day and I don't have to drink this horrible gallon worth of medicine. It's going to give me the runs and it sounds also horrible and I feel awesome, so there's really no reason for me to go through this test. The reality is colon cancer has no symptoms until it's very advanced. 30% of you people have a polyp right now and don't know it. In fact, probably 1% or 0.5% to 1% of you might have an actual cancer and not know about it. So you should have a colon cancer screening test. I have another video that talks about a Cologuard that you are free to look over if this bowel prep video doesn't sell you on the fun aspect of a colonoscopy. But for those of you who are brave and deserve a lollipop for going through this procedure, or at least some Jell-O, let's discuss what a colonoscopy bowel prep is. The day before a colonoscopy, we put patients through something called a bowel prep. And the reason is to see what it is that we need to see. The colon has to be free of all contents. It is a long tube. I do not care if you have regular bowel habits and poop every morning. That is not clean, okay? I know you feel like you're clean and bright and chipper, 6:30 in the morning after you've pooped, but having said that, that's not enough for us to see what is happening. Believe me, you want us to see every little nook and cranny. The inside of your colon needs to be bright and pink like the inside of your mouth for us to see what is going on. So in order to get there, there's a series of different bowel preps that will help. The old-fashioned prep, which gives us such a bad reputation, is the gallon go lightly prep. And it's an extremely good prep, and it is covered by all insurances. In fact, there may not even be a copay for that. I mean, you're talking a couple of bucks and they'll give you the gallon of Go Lightly. So if you don't mind drinking lots of stuff, get the gallon of Go Lightly, The key to the Go Lightly prep, however, is get the flavorless and then get some little Mio flavor squirts. So when you mix up your whole gallon of flavorless Go Lightly, you pour it into a glass, you can flavor each glass something different. What makes the gallon prep so difficult is that it all tastes the same. And what the company says is a good taste, I am not 100% convinced is a good taste. So they were doing pineapple for a while. You cannot drink a gallon of pineapple, my friend. It will ruin pina coladas for you forever. And I can't stand to do that to you. So I would say unflavored, get either Crystal Light or the little Mio squirts, provided that it is clear and it is not red, and flavor your Go Lightly that way. If it comes down to dollars, there are some patients from a health standpoint, you have to have the Go Lightly because it is the safest prep. That's my suggestion on that little hack there. The other preps in modern terms are very salty. They are low volume preps. By definition, salty low volume preps are going to require lots of water or other fluids to flush through your system. So patients like the low volume because you don't have to drink quite as much of the ick. However, you need to chase all that stuff down with lots of water to flush it through your system so that it works properly. In the end, everyone is still drinking the same amount of fluids. The question is kind of how you get there. And the choice is totally up to you. I have a tendency to write for two different types of prep. One is called the SU prep, which is a sodium sulfate prep. And the other one is called Plinview, which is a combination of a polyethylene glycol, vitamin C, and I think they've added some sodium sulfate to that. So that way you can have really super concentrated preps, makes it a little easier to take. So basically my suggestions on the day of a bowel prep are to do this. Number one, you are to eat a small breakfast the day before your colonoscopy. Make it something that does not have a lot of heavy vegetation. Stay away from grapefruit and broccoli and spinach, salad, those kinds of things for a day or two before the colonoscopy. Those heavy vegetables are hard to flush through the system, and because they're hard to flush through the system, you won't actually have a clean prep. And I know what you're thinking, Dr. Toker, vegetables are so good for you. I need my fiber. For 2 days, it's going to be okay. All right, you don't want that stuff in your system when you're trying to flush it out with a bowel prep. All right, so the day before your colonoscopy, you may eat a small breakfast. Starting at 9 o'clock in the morning, you're going to switch to clear liquids. What is a clear liquid? A clear liquid is anything you can see through. Coffee is a clear liquid until you put milk in it. Iced tea is a clear liquid. Diet Coke is a clear liquid. Apple juice, clear liquid. So is Gatorade. So these are all clear liquids, although they're all of varying colors. The only thing I want you to stay away from is red and purple, because red and purple can look like blood in the GI tract and then can kind of confuse us. Are you bleeding, or is this red jello that you've just had? So stay away from red and purple just to make our lives just a little bit easier. Now, another common question is, doctor, vodka is a clear liquid. You can have one vodka drink if you care to. You can have one glass of wine. When my mom had her colonoscopy, she insisted on having a glass of red wine, which goes against everything that I normally would stand for. Frankly, it did not interfere with her colonoscopy. So one glass, if you must. If life is so stressful that you must have a margarita, provided that it is clear, there's no pulp. Notice how you cannot have a pina colada. That is not clear. Then you can have one glass of wine or one beverage of the adult category, should you choose to do so. All right, there I said it. Just one, small one, because you're having anesthesia the next day. Okay, we don't want to interfere with anesthesia. Well, I just want you not freaked out about your bowel prep. Furthermore, you don't want to do a bowel prep while drunk. That's not good for your carpet, okay? So do yourself a favor and don't do that. Alrighty, so you're going to be on a clear liquid from 9 o'clock in the morning until 4 hours prior to your colonoscopy. So you only have to be on an empty stomach for 4 hours, and that is very different than the old days. Secondly, this prep, unless you do the gallon of stuff, is 2 small doses, and I separate those doses by a good 4 hours. The instructions on the box will have you do 1 dose at 10 o'clock at night and 1 dose at 4 o'clock in the morning of your bowel prep. Now, I personally was not going to do it that way for my colonoscopy because I had a 7 o'clock in the morning procedure. Like, how am I going to make it to the GI lab for 5:30 if I just finished drinking the prep at 4? Furthermore, how am I going to get some sleep if I drank a prep at 10 o'clock at night? So I tell my patients, look, you don't have to take the prep like it says on the box. If you must, if you're a rule follower, if it's killing you that my instructions are different than what is printed on the box, for God's sakes, follow the box. It'll be a beautiful prep. Having said that, for humanity's sake, I would say if you started your bowel prep at 3 o'clock in the afternoon or when you get home from work, whichever comes first, drink the first dose, chase that down with lots of water. Drink your second dose 4 hours later, chase that down with lots of water. Most of that prep will be through your system by 11 o'clock at night. You'll have a pretty normal night's sleep. You'll easily be able to get into a car to get to the GI lab the next day. I've been telling my patients to do it this way for 16 years. It is a decent prep. I can see what I am doing. I have no complaints about that. Okay, so that's what I would tell you to do, okay? That way you can have a decent night's sleep, you can have a good prep, and you won't have any accidents in your car on your way to the hospital. Important caveat, do not start drinking this at work. Do not start drinking this in the car on the way home from work. Do not start drinking this and think, oh, geez, I'm out of Jell-O. I think I'll go down to the Kroger and buy some Jell-O. You will regret it. This stuff hits absolutely without warning and will last for untold numbers of hours. So the best thing to do is to hunker down like it's the zombie apocalypse with all the stuff that you could possibly need and just then start drinking the prep. All right, does that make sense to everyone? Okay, so you're gonna be hungry and pooping. Ooh, one last industry secret. Now, don't tell anyone. The GI doctors never ever take care of your butt in the way that I take care of your butt. Your bottom was not designed to poop like this. It's a lot of activity that's gonna take place. I would suggest you keep the skin as dry as humanly possible. If you want to put a little Vaseline back there, kind of make the area waterproof and wipe-proof, that'd be fantastic. Spend some time in a nice warm bathtub if you need to, if your hiney starts getting sore. Also, and this is going to sound strange, get a fan or a hairdryer that has one of those little blue cool buttons and get some cool air on the skin. The skin of your bottom is the same kind of skin that's on your eyelids and your mouth. It does not like to be chronically wet, and it does not like to be rubbed a lot. It'll get really sore really quick. So Vaseline, keep the skin dry. A nice warm bathtub will also help improve the condition of the skin. Does that make sense? Okay, so baby your bottom on that. All right, we'll see you soon. Bye-bye.